Okay, sir. Good afternoon, everyone. Myself, Mega Case. My topic is explain the antifungal drugs and its current usage, along with the mode of action. Coming to the introduction, antifungal drugs are the medications to the people. They can use to treat the fungal infections, and people can take the antifungal drugs orally and apply them topically, or administer them intravenously through a drip or something. Antifungal medications usually work trusted source either by killing the fungal cells or stopping them from growing and multiplying. Part of the cells that the antifungal drugs target include the fungal cell membrane and the fungal cell wall. These are both protective parts of the cell that can cause the cell to leak and die when they're damaged. People bodies do not have these structures, meaning antifungal drugs can target the fungi without harming the body cells. Usually, pathogenic fungi of animal and humans are filamentous molds and intracellular yeast. Fungi cell wall contains chitin polysaccharides that makes it rigid and acts as a barrier to the drug penetration. And cell wall contains ergosterol that influences the efficacy and risks the drug resistance. Most of the antifungal drugs are fungistatic with infection clearance and largely depends on host response. And coming to the classification of antifungal drugs based on chemical structure, the this includes polyenes, macrolides, imidazoles, and benzofurans and iodides, and based on their site of action. Either it may be a systemic and a topical antifungal drugs. Miscellaneous classification includes organic acids or their salts or other inorganic salts. Drugs for mucocutaneous infections. Systemic drugs consist azoles, fluconazole, fluconazoles, itraconazoles, and vericonazoles, griseofulvin, and terbinafines. Topical drugs, azoles, ketoconazole, miconazoles, and clotrimozoles, and tioconazoles, etc. Nystatin and terbinafines, and other drugs, tolnaftate and cyclopirox, and etc. Drugs for systemic infections consist azoles, fluconazoles, itraconazoles, and vericonazoles, and most importantly, amphotericin B, and flucytosine, and caspofungin. Classification based on the mechanism of actions, fungal cell wall synthesis inhibition, caspofungin, and bind to a fungal cell membrane ergosterol, that is amphotericin B and nystatin, and inhibition of ergosterol and lanosterol synthesis terbinafines, and inhibition of ergosterol synthesis azoles, inhibition of nucleic acid synthesis 5-flucytosine, and disruption of mitotic spindle and inhibition of fungal mitosis is greasefulvin, and miscellaneous consist some of the antifungal drugs. And classification of structures, antibiotics consist polyenes, amphotericin, nystatin, and heterocyclic benzofurin. Antimetabolites, flucytosine. Azoles includes imidazoles, that is ketoconazoles, and clotrimazoles, etc. Triazoles consist fluconazoles and itraconazoles. Allylamines, terbinafines, and butanafines, and echinocandins, caspofungin, and etc., and other topical agents, tolnaftate, and benzoic acid, etc. Coming to the azoles, that azoles is a systemic synthetic antifungals, and broad spectrum inaction, and fungistatic, or sometimes it's a fungicidal depending on the concentration of drugs, and most commonly used drug, classified as the imidazoles and triazoles. Imidazoles consist two nitrogen in their structure, topical econozoles and miconazoles, systemic ketoconazole. Triozoles consist three nitrogen in their structure, fluconazoles, itraconazoles, and toconazoles. It's a topical for sub. Azoles, ab- absorption of azoles from the stomach is affected by the food and gastric HCl. And fluconazoles can reach us to the CSF with good concentration. The other drugs cannot. Fluconazole is exerted in the urine, mostly uncharged. Mechanism of action: azoles inhibit fungal cytochrome, that is P50, necessary for the ergosterol synthesis, a major component of fungal cell membrane. This will alter the membrane permeability and disrupt its function. And azoles are broad spectrum fungistatic against many dermophytic and candidates. Some of the uses, therapeutical uses, superficial fungal infection. It can be used for superficial fungal infections and dermophytic infections for skin, hair, and nail. And adverse effect, hepatotoxicity and increases of serum transmittance, and azoles inhibit the hepatic enzymes. Ketoconazole causes anti-androgenic effects. And amphotericin B, they obtained from the Streptomyces nodus, and amphotericin B is a polar compound that cannot be absorbed from the gut or cross of central cerebro, insoluble in water, so colloidal suspension prepared with the sodium deoxycholate, 90% bound to the plasma protein. It should be administered or intrathecal. Half-life is 15 days. Because of the significant toxicity, amphotericin B is available in the liposomal form, in which drug is enclosed in a lipid microsphere, that is called liposomes. These lipid microsphere binds preferentially to ergosterol in the fungal cell membrane with lower affinity to mammalian cell membrane. Therapeutical uses: amphotericin B has the broadest spectrum of activity, treats several systemic fungal infections that includes Candida albicans, Heptoplasma, and etc. Adverse effect: acute reaction. It may cause chill, fever, headache, pain all over the nausea, vomiting, etc. And also long-term toxicity it will be there. And then CNS toxicity in intrathecal administration, headache, vomiting, nerve. Then also hepatotoxicity rarely. Coming to the mechanism of action, amphotericin B is polyene macrolides that binds to ergosterol of fungal cell membrane and forms pores that alter membrane stability and allows leakage of cellular content. And other antifungal drugs consist flucytosine prodrug, pyrimidines analog. Mm, Mechanism of action: flucytosine is actively transported into fungal cells and is converted into the uracil form 5-fluorouracil, which inhibits nucleic acid synthesis. Human cells lack the ability to convert large amount of flucytosine into 5-fluorouracil. Uses: used in combination with other antifungal agents because of rapid development of resistance to treat several systemic fungal infections. Adverse effect: flucytosine is rarely non-toxic, and depression of bone marrow at high doses and hair loss it will be there. Mm, then greasesulfame. Uh, Mechanism of action: rhizofulvin binds to microtubules and prevents spindle formation and mitosis in fungi. It is fungistatic and requires long duration of therapy. And the drug binds to keratin structure and accumulate in skin and hair and nails. Therapeutic uses: used orally for long-term therapy of dermatophytic infections of hair and nail. Then adverse effect: hepatotoxicity, that is liver function should be checked during therapy. And hypersensitivity reaction to skin rashes and etc. And CNS effect: infusion fatigue and etc. Nistine is a polyene microlides, very similar in kinetics and mechanism to amphotericin B. It is too toxic for parenteral administration and is used only topically. It is active mainly against Candida, and it is used topically for oral pharyngeal and vaginal candidiasis. Caspofungin: it is large cyclic peptides that disrupt the fungal cell wall, resulting in cell death. Used by root of for therapy in severe invasive aspergillosis and esophageal candidiasis who fail to respond to amphotericin B, used as a second line drug. And then coming to the summary: antifungal drugs can treat fungal infections. There are a wide number of different drugs, as there are many different fungi that can cause infections. Most of time, healthcare professions can treat a fungal infections easily, but occasionally some may be more serious. People with a weakened immune system should seek medical attention if they suspect they may have a fungal infection. Thank you, sir.